Hi, everyone. Thanks for tuning into the Buzz Podcast presented by Quality Rehab Management, where we're dedicated to sending out quality information that you can share with your teams as quickly as possible. We're trying to get something out every single day that you can share with your therapy team members, your nursing home team members, your healthcare providers that serve aging adults during the COVID-19 pandemic. We are, as a team, collecting information from all of these different reliable sources, the American Physical Therapy Association, APTA, CDC, all of the different organizations. We're just collecting, processing, putting it together, and trying to get information out to you that you can share with your teams quickly, but also recognizing that it could change tomorrow. We're learning new things every single day. We're getting new guidance every day. And so I encourage you to subscribe and just check in, stay up to date. I have a webinar scheduled tomorrow. So today is March 20th. It's a Friday. And there's webinars scheduled all weekend. And the one I'm scheduled to listen in on tomorrow is guidance for the acute care therapy teams. And so that will be really great information that I will share with you next week in upcoming episodes. But each week I would like to take a few minutes, usually on Fridays, to go over the week's frequently asked questions, because we got some of the same questions all week. So if our teams had these questions, maybe your teams do too. And then I also want to reserve some time to shout out a couple therapy teams, because just it's crazy out there, and our therapy teams are doing amazing things. And whenever I get these stories, and I got a lot of them this week, I asked all of our managers in the field to send me the great stories, like send me the good things, because we're just in the middle of some bad, like it's just not good out there. Send me the positive stories, send me the great things that are going on in your buildings that the therapists are doing to keep up spirits and keep their patients hopeful and engaged during this crisis. And I had a lot of stories to choose from. I had to pick a couple, and that was challenging. So that was a really good thing. So I'm going to share a couple of those stories with you that you can share and give those teams shout outs that they deserve. But for frequently asked questions, we got a lot of questions this week about sanitizing and disinfecting equipment. Therapy gyms, historically, you've got a lot of therapists working in a shared space, and then you've got a lot of patients coming in. It's just, we're cleaning constantly, but it's, there's just a lot of people, there's a lot of traffic. And so we have, with our team at QRM, that has been a huge focus since all of this started. Just get in, disinfect, clean and disinfect, right? Two separate things. Clean first, then disinfect. Get all of the germs away, so we're going to reduce the risk of spreading any type of infection with any equipment that our patients come in contact with. So one of the first questions that we got are what disinfectants are recommended to be used? You've got all sorts of different types, all sorts of brands. Are aerosols okay? What are we supposed to be using on these patient contact equipment and surfaces? And the CDC is recommending EPA registered disinfectants, and you can find the full list of EPA registered disinfectants at epa.gov, and I've included the website in the show notes. But I looked at the list. There's a lot on this list, and I'm not endorsing a company or companies, but there's lots of companies that we're very familiar with, Clorox, Lysol. There's companies you're not familiar with, but there's a lot on this list that make the cut. So find something on that list, clean first, then disinfect all surfaces and objects between each patient encounter. And if you have a symptomatic patient, they should not use this stuff, right? They should really, we want to be keeping them in their room. We really want to be keeping everyone in their room, right? Like we want to reduce the moving around. The more people are moving around, the more people that are touching other people and touching other things, the risk of spreading increases. So, but there's going to be situations where you have to use therapy equipment. Like you have a patient going home who has to be able to go up and down stairs. You're going to have to use the stairs, which means they're going to be touching the side rails on your steps. Maybe you have a patient that can't stand on their own in their room and you have to use the parallel bars. You're going to have to use some things in your gym. Just be smart about it. And any symptomatic patient, we don't want them using those pieces of equipment. Next question, how do we properly disinfect gait belts? So this was a big one that came up, right? Because our gait belts, the ones that we use most of the time, are those cloth gait belts. And cloth gait belts are really intended to be for the patient, right? They're for one patient, and we shouldn't be sharing them and moving them around. They can be laundered, but that sounds, I don't know that we're going to be able to do that. So either you're going to launder your gait belt after each patient use, or we need to use the vinyl gait belts that can be cleaned and disinfected after each use using the proper EPA registered disinfectants. So cloth gait belts should be issued to the individual patients or laundered in between each patient contact, or use the vinyl gait belts and clean them off. Okay. And then what about wheelchairs, walkers, canes? I mean, it's the same story. They should be clean and disinfected in between each patient. If you have a symptomatic patient that needs to use a walker or a wheelchair, it's now theirs, right? Make a note, label it. It is theirs. We definitely don't want it accidentally ending up in the hall in somebody else's room, right? Like if we have a symptomatic patient that walks and we're working on walking in their room, getting to and from the bed to the bathroom, it's their walker, okay? Keep it in their room, label it, put a sticker on it so that everyone knows this does not leave this patient's room. But for any other devices, you would use your EPA registered disinfectants to wipe it down in between each patient contact. Okay. So that's all the cleaning stuff, right? I feel like we've got a good handle on cleaning. We know what we need to be doing there. The podcast yesterday, talking about the role of PTOT and speech services in long-term care. Our role is to provide the essential services, the skilled services to meet the essential needs of the patient. And we are essential. We are part of that essential care team. But we need to do it at the same time while reducing the risk of COVID-19 getting into your building, and if and when it does, to keep it from spreading around. So that's our mission. Keep it from getting in, keep it from spreading. And a clean, disinfected gym is a great place to start, but we want to keep people out of the gym. Again, we don't want a bunch of traffic. So really working with patients in their individual spaces, finding alternatives to getting them connected with their family members and their friends, FaceTime, give them a call if they have an iPad or a laptop, any other way to get them social. Let's find another way, but really limiting that traffic, keeping people, we're not doing group therapy, we're not, we're really practicing those social distancing mandates, recommendations. All right, so that's the cleaning and disinfecting. So the other cluster of questions that we've gotten all week, all the way through today, and I wish I had better answers, but I just don't. But I'm just going to share it anyway, and hopefully next week I'll have more guidance to share, but it's on this telehealth e-visit thing. And I think in the very first podcast of this series, I was super excited because, we got a message. I jumped the gun and I was like, oh, we can do telehealth now. We can't do telehealth. That is not true. We have, therapy telehealth services are not reimbursed under Medicare. That did not happen with the changes, the CMS changes this week. So question number one, can I bill Medicare for telehealth services? No. Physical therapists, OTs, speech, no, we can't do that. But we have this e-visit that we're really not the audience for it, for this e-visit, skilled nursing therapy services. It's much more of an outpatient service. It makes complete sense for outpatient therapy services. I'm excited for them to get in and use it because I think it opens the door, because they're going to do it right. Like, I mean, the clinicians that are going to be using this e-visit appropriately for outpatient, they're going to do it right. They're going to make us proud, and they're going to open the door for e-visits and telehealth services for the rest of the markets and settings. But let me explain this e-visit, because technically we can bill it, but let me just explain what it is, and know that next week there are multiple trainings scheduled. I'll be attending, other members of my team will be attending, to just get more information about it and we're trying to figure out how we can make this work for you in the field and not have it not be an additional burden on you. It's intended to be beneficial for the patient and for you. We just don't know yet for us. We haven't really seen that the juice is worth the squeeze in the skilled nursing setting. So stay tuned, but defined, what is the e-visit? It is a non-face-to-face, patient-initiated digital communication that requires a clinical decision that otherwise typically would have been provided in the office. So I was on a APTA Facebook Live town hall today, and they talked, there was a lot of discussion about this, and it doesn't have to be video. It's not intended to be a video conference, because if it's a video conference, now we're moving into telehealth. Like, we're moving into a space that we're not supposed to be. We're really not, that's not the intention of this e-visit. The e-visit is, we're chatting, we're checking in, we need to connect with the patient, but we can't get that in-person visit, okay? That was kind of my interpretation of it. There are billing codes that cover a week of time. So the billing codes cover up to 7 days, and you are billing the code based on how much time you spent connecting with the patient, communicating with the patient, setting up this digital communication. So there's 3 different billing codes for different amounts of time that are billed within that 7-day period, up to 7 days. And these can be conducted online or via some type of digital platform. And when I was listening to a recorded APTA webinar from yesterday, there is some flexibility with the types of devices and platforms that we can use right now in this crisis. So a phone call is sufficient from what I understood. And again, I'm going to get more information from just taking more courses and learning more and talking with more clinicians. But so can we bill it? Yes, there's some different modifiers that we need to add. Yes, and Kasamba and Optima are working to make this available for us. They may have already done that. There was some email communication that went out today. But again, trying to figure out how this is going to work for us, the therapists that work in skilled nursing facilities, I just don't know yet. So stay tuned. We will have more to come. But I've gotten a lot of questions about it, and so I definitely wanted to talk about it, but I wish I had more to share, but just don't yet at this time on March 20th on Friday. Hopefully we will have more to share next week. All right. So now my favorite part of the week, where I get to shout out a couple teams for doing amazing, inspiring work out there. I got messages from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 or 14 programs, which, and I put out the message, the call for great stories, probably midweek, like around Tuesday or Wednesday of this week. So I got a lot of stories in a very short amount of time that I had to make decisions on how to get this information out to you all. But so I want to give a shout out to some of the buildings that I'm not going to specifically share a story from, but I kind of took some of the things that you shared, because there were a couple of you that are doing similar things, but they're all wonderful. But the teams at Weston Inn, at Wurzbach, Sagebrook, Hearthstone, Trinity, Windcrest, Weston Inn, Temple Living West, Park Bend, and Regency House all sent me stories or something creative that they're doing to work together as a team, help out their nurses, help out their CNAs, help out their patients during this time, help lift their spirits. And so I want to shout you guys out, but there were 3 buildings that I want to specifically highlight because their stories really touched me or made me laugh. There's one that just made me smile, made me laugh a little bit. But I want to share them with you so that you can take that away and just know that there's wonderful people out there doing wonderful things in the middle of this crisis. So Stonebridge and Austin. This story, it's just, I know this happens everywhere, but a therapist, a physical therapy assistant at our building in Austin, one of our programs in Austin, the rehab director reached out and said that, she witnessed that he was so calm and soothing with a very upset, crying, confused, upset resident, because she could not understand why her family had not visited her, had not contacted her. She was scared. She hadn't slept the night before. She was worried. And he just talked to her. He took the time to calm, soothe, console, precious time, right? That he's probably spread really thin too. I can only imagine what this looked like. He's probably thinking to himself, I've got 20 people that I have to go help. And, but he did the right thing, took the time, lifted it, helped her relax, soothes her, and they apparently schedule another time. It doesn't even sound like this person is on his schedule. So this is just somebody he on his own helped console and calm. But they set up a time to chat tomorrow. So they have a scheduled chat tomorrow, and she was really excited about that. And so I thought that was a really, really great story. So the second building that I want to shout out is, and I know the director at this building, he's a PT in San Angelo. And when I read the note that came through, I was like, I can totally see him doing this. This is funny. So my friend Robert at Meadow Creek, he sent that he's planning some individual outdoor activities. Of course, we've got springtime coming, and people are just cooped up, and they're not having visitors, so they're feeling isolated. So he wanted to make sure he was working in interventions to get people outside. And he said, we're planning on throwing paint-filled eggs at large art boards and see what happens. And that just made me laugh out loud, because that's so fun, so not serious, such a great workout. You want to talk about working on balance and range of motion and weight shifting and all of the things that go into being able to throw something. but also just letting go, that it was just a really fun, engaging activity where you really could just bring one patient out at a time. There's no worry of a social being too close within the 6 feet, and each person gets to contribute to the art project. So I really hope that I get a final product to share with everybody, because I'm sure it's beautiful, or the idea of it is beautiful. Maybe I don't want to see it, but anyway, I thought it was really great. So a shout out to the team in San Angelo for that great idea. I can't wait to see the artwork that came out of that. So my last crew that I want to shout out is in Temple, in Texas. So Temple Living East. And the email that I got describes that this building has a lot of staffing challenges, as I imagine many programs out there are experiencing right now. Very limited nursing and CNA staff. They probably already always were a little bit limited because, it's just hard to find caregivers right now. And also we've got a pandemic where people are sick and having to stay at home. They have kids at home. So anyway, this building has lots of limitations. And the rehab director shared that the CODAs, the occupational therapy assistants, they've really just dug in. They've helped out by showering any patients that are on their caseload. They're doing all of the showers at least twice a week in order to help out that the patients are getting their showers and that their patients are getting ready for breakfast in the morning. They're doing the care. They're doing all for their patients. They are taking care of business, teeth brushed, getting dressed, hair combed. They're incorporating all of their skills into the day-to-day. And I can't tell you, to me that, maybe that seems obvious, but I'm so thankful that they've taken that initiative, taking that burden off of the probably very limited nursing staff so that they can focus on the non-therapy patients. But I just really appreciated that they were working together to help out the entire building, help out the residents, help out nursing, working as a team. That's what this is all about. We're in this together. Well, I thank you all so much. If you have any comments or questions or anything you'd like me to share on the podcast, please let me know. My name is Casey Lee. You can email me at clee@qrmhealth.com, and stay safe and healthy, everyone. Bye.